Well, hi everyone. I'm Tracy Jarvis, and I'm one of the Sensory Motor Psychotherapy Institute trainers.
And I'm Pat Ogden, and I'm the founder of the Sensory Psychotherapy Institute. And I'm really excited about working with Tracy on an upcoming webinar that we're going to do together.
And we've got this up and coming webinar, which is on the 5th and 6th of September. And it's going to be on complex trauma and PTSD, something that's really prevalent in clinical work at the moment. And guess what? It is absolutely for free. So sign up and help spread the word. So, Pat, with complex trauma clients, threat seems imminent really at any time.
Mhm, mhm. Yeah, most of the people that I've worked with live in the past as if trauma is happening in the present. And one of the things I'm excited about this webinar is that we're going to show some almost complete sessions, one of stabilization and helping a traumatized client just resource and bring his arousal into a window, and the other of processing the effects of trauma. So you really get to see how sensory psychotherapy addresses this continual threat with two different client scenarios.
And it seems, Pat, I don't know about your clients, but certainly, with my clients, I often see those states. They're either, totally collapsed. And I imagine that is true for many clinicians sort of who work with complex trauma, or folk or clients are in states of, out of the window, in hyperarousal or dissociated.
Uh-huh. Mhm.
So, yeah, go ahead.
Well, yeah, and sometimes it's even almost a combination. Like the client we're going to show, he is very collapsed, but his mind is going a mile a minute, and there's so much anxiety in his system, but he can't mobilize to do anything, right? So we're going to show how we can address that and help him find from within this sense of a little bit of a sense of agency. Yeah.
And Pat, for folk who don't know about sensory motor psych therapy, mobilize might just be a word, but talk a little bit more because, one of the things that as a trainer we try and help clients do is work with trauma or complex trauma, but from the body. So
Mhm.
talk a little bit about kind of that word mobilize that you've just used.
I was using it in the sense of thinking about many clients with complex trauma can barely get out of bed,
Yeah.
let alone being able to accomplish their dreams or have satisfying relationships and so forth. And so that's was this client's experience. He wanted to, but he couldn't mobilize himself to do the things that he wanted to do. And we know that trauma is very much body based. So we work a lot bottom up, working with shifting how the body's organized so that emotions and thoughts and even your feelings about yourself start to shift as well. And that's what we're going to illustrate in these videos.
Yeah. And these videos, I've only just had a look at them that we're going to hopefully be looking at and analyzing and digesting and answering questions. There's so many conflicting parts within these two videos in the clients that we're going to see. And, we're also going to be talking a little bit perhaps about behavioral systems, action systems, and how sort of the complexity, hence in complex trauma and PTSD, and certainly in how we practice and sensory motor psychotherapy, that there's a lot of competing systems.
Yep. Which lead to parts of the self that aren't integrated, that have competing agendas and goals. So I'm glad you brought that up because in the second session that we're going to show, we'll really be working with different parts of the self in a highly traumatized client and how the body can be an asset in helping those parts communicate and actually integrate that lead to a new, more unified sense of self. I remember at the end of that session, the client says, "I feel like I'm the me that I never could be," something like that. A different sense of herself when that integration starts to occur.
Yeah.
So,
Yeah. And so what I hear you saying is that, we're going to be demonstrating through presentation analysis questions, not only are sensory motor interventions effective at a behavioral level, but we're also talking at identity too.
mhm, mhm, yep, I think that's true. And our webinar, we're going to give some, theoretical background. We'll do some brief experiential exercises, and then analyze these two videos, takes question and answers. So you'll walk away, I think, with a good sense of how sensory motor psychotherapy addresses complex trauma, and also with some tools that you can take away and start to play with in your practice.
So if you're interested in finding out more around, how to work with clients, complex clients who are switching in session, you don't know what to do, join us on the 5th and 6th of September, Pat and I, for this free webinar. And we really look forward to seeing you as part of our sensory motor psychotherapy community.
So thanks for watching, everybody, and hopefully we'll see you in September.